Are you living a stressful lifestyle? Are you eating an unhealthy diet? Are you overweight? Do you feel chest pains from time to time? If the answer to any of these questions is yes, please stay tuned. Hello, Deltona TV and Heartbeats. My name is Rafael Ramirez, and I have the privilege of working at Halifax Health in market development, representing Halifax Health's mission in the west side of the county and in the city of Deltona. With me today is Dr. Gary Blume, family practitioner and primary care physician at our Deltona Care Now clinic. Dr. Blume, welcome to the show. How are you?
Thank you, Rafael. My pleasure to be here.
Good to see you. Why don't we tell our audience a little bit about your background and medical education and specialties?
Sure. I'm a family practice physician. I've been in practice about 27 years. I trained at Duke University Medical Center in Durham, North Carolina, and privileged to work under a number of great doctors, I have to say. It's been my privilege. I'm a board-certified doctor in family medicine, but I also have subspecialty training in the prevention of heart attack and stroke. And that's an unusual field in the U.S. There's probably about 1,000 of us doctor-wise in the country. And I did that actually after I was in practice about 15 years. And because it really is in the field I started in, family medicine. We not only take care of the whole family and all your aches and pains and daily illnesses, but one of our big goals is to keep you healthy and keep everybody in Deltona healthy. And since heart attack and stroke are one of our biggest problems, I got interested in that and I went back and did subspecialty training in it. And I've spent, as I said, a lot of my career in Seattle, but have been pleased to be here in Florida for the last couple of years. And very pleased to be part of Halifax and our operation here in Deltona.
Well, we are pleased to have you, and as maybe the public knows, Halifax has been open since 1928. Our current team is 5,000 strong. We have nearly 500 physicians that provide care for 46 medical specialties. Halifax is also, as you know, the only safety net hospital, as well as the only comprehensive continuum of care provider in our county. So we're pretty proud of that. So please tell us more about the Deltona Care Now, the hours, the services we offer, and where it's located.
Certainly. We're at Saxon Boulevard, right just off the highway in the public shopping center, right next to Wendy's. And we are a pretty unique clinic in that we serve both walk-in patients, including patients who aren't our own patients, and we provide comprehensive preventive and ongoing care for all ages, starting from the newborn to the elderly. And partly because my training and care of patients throughout my career has been all ages. And even though my specialty is the prevention of heart attack and stroke, we see lots of children, and I have throughout my whole career. And of course, from a prevention standpoint, it starts at a very young age.
Let's explain to our viewers the difference between a primary care physician and maybe an urgent care physician. I think the primary care provides services, as we said before, for the continuum of care throughout the lifetime of the patient, right?
Yes, and it is, you know, I certainly understand well, it's very challenging for people to understand how doctors are organized because it is a complicated thing. And there are many specialties, many types of doctors, and it's hard for patients to fathom what that is. And indeed, we offer a continuum of care and ongoing care for patients so that the patient is seen fairly much by the same person all the time. Whereas walk-in and urgent care clinics are there to see you not on an ongoing basis, but for a very specific problem that isn't serious enough for you to go to the emergency department, but needs to be seen immediately, and you can't get into your own doctor, or you don't have a doctor. Now, ideally, in primary care, when we're doing the continuum, we would like to be able to see our own patient anytime. Now, practically speaking, it's not always possible, but that is our goal. And in a well-functioning practice, we meet that goal 99% of the time.
Excellent. And you spoke a little bit earlier about the reason why you got interested in cardiovascular medicine or subspecialty. So let's talk about heart attacks and strokes. What are heart attacks and strokes?
Very good question. Exactly. Very, very good question. Always good to start at the beginning. And, the whole idea of heart attack and stroke is, the name helps us a lot. Heart attack is something that occurs out of the blue. Stroke is something that occurs out of the blue. They're very aptly named. These are the #1 human diseases. Fundamentally, there are 2.1 million heart attacks and strokes a year in the United States, which means that about 1 out of every 125 adults every year has a heart attack or stroke. So it's a staggering problem, staggeringly large problem. And heart attack and stroke are really the same problem occurring in the heart or the brain. And what happens is, like many parts of the body, the heart and the brain and other parts of your body need blood supply. Everyone knows if you don't have good blood supply to your finger, you get gangrene and the finger falls off. And when you have a lack of blood supply to a part of the heart or the brain, in the case of the heart, it causes heart attack, which is actually, or in the case of the brain, stroke, which is actually the death, just like your finger dying off, of a small portion of the heart muscle itself or the brain. Okay. And again, as I said, those are the #1 human diseases, and they cause a staggering amount of death and incapacity in the U.S. every year.
We, generally speaking, people are scared of the word heart attack and stroke.
Sure.
But why are these important? Why are these dangerous and important diseases?
Many diseases and many things have symptoms that tell you that something is wrong. So when you have the common cold, of course, you've got a sore throat, cough, and fever. Or if you have acute appendicitis, you have bad abdominal pain. If you have a kidney stone, you have very bad pain in the kidney or in a region around the kidney. But with heart attack and stroke, again, as I said, they're aptly named because they appear to occur out of the blue. As everyone knows, you can feel fine and then suddenly someone has a heart attack and dies out of the blue. And there's often not much warning or no warning. And so since these are big common diseases and they occur without warning, this is a very important disease to try to prevent, since when you have a symptom, you already are having something very bad happening to you. Now, the cardiologists are very appropriately proud of the fact that they see many people with chest pain, and they will go in and put a balloon in and do an emergency bypass, and they save many lives. What we would like to do is to get people before they get to that point, since again some people die before they get to the hospital. With stroke, people are often incapacitated no matter what you do. Right. With heart attack, people often have damage even if you can save them. So we want them, in our parlance, that's falling off the cliff. And we want you to not fall off the cliff. We want you to stop you before you come to the edge of the cliff. So that's why it's important, and that's why, unlike some things, you need a little guidance from someone that is knowledgeable in this area to guide you, because you don't know what your risk is. You don't know if that's going to happen to you. And every one of us knows people that have died suddenly.
Yes, we do, unfortunately. Yeah. Well, let's now, for our viewers, let's just talk about the risk factors and how perhaps each of them manifest themselves and the like, please.
Right, certainly. And, this, fortunately, a lot of these have become reasonably well known. Everyone knows if you eat a poor diet, if you don't exercise, cigarette smoking, if your blood sugar is poorly controlled, if you're overweight, if you're stressed, these are obviously big factors. Now, one thing that people don't know is their blood pressure. There's no way for you to know that. Again, unless your blood pressure is very high, there's often no symptoms from it. So that's something that has to be checked. And I think everyone in the United States knows that idea. And also, cholesterol, people know that's very important. Mm-hmm. And again, you don't know that without it being checked. But again, I mentioned blood sugar. Everyone knows that's important, and people that are diabetic know that it's very important to control their blood sugar. But one thing that isn't much appreciated among patients is that before you're ever a diabetic, blood sugar elevations add much risk to your chance of heart attack and stroke. So we want to identify blood sugar problems long before that. And of course, everyone is aware of diet as an important component, but I think there's a lot of confusion about what elements of that diet have really been well proven, because one year we hear the Atkins diet, and the next year we hear the Mediterranean diet, and the next year we hear another diet. But it's not that we don't understand about diet, it's that indeed there are a lot of varied diets that can work, and we want people to understand the basic principles that they don't have to follow any unusual diet, only a few simple things.
You and I had a long conversation about sugar, and you taught me quite a bit, and I appreciate that. You also mentioned to me that dental care was a factor I had never thought about.
Yes.
And so maybe mention that for our viewers.
Sure.
It's kind of a
it is
out of the box.
It is an out of the box thing, and actually, again, because this is my subspecialty area, these may be things that people haven't heard much yet, and we hope they're going to hear a lot more about them soon, because they are very well established, actually. So, interestingly, dental disease, and in particular gum disease, so what we call periodontal disease, or inflammation of the gums, which 70% of adults have, and in the U.S., is an important factor. So, someone I know well, Scott Grundy at Loma Linda University, Dr. Grundy did an interesting study where he simply had people brush and floss twice a day.
Oof.
And yes, and very few people floss twice a day. I know before I was in this field, I honestly admit I didn't do that. But Dr. Grundy did that and had other people just do what they normally do. And at the end of 5 years, there was a highly significant 20% decrease in the heart attack and stroke rate. And that is equal to taking, for example, relatively high dose Crestor. So by simply brushing and especially flossing your teeth twice a day, you can reduce the risk of heart attack and stroke as much as by taking Crestor, which you've heard about on TV a million times.
Yes, we have. Very interesting. And unfortunately, we are living in a county that is categorized as the, I believe, the 43rd less healthy in the state of Florida. So all of these preventive or informational facts are really important to our viewers. Let's go a step further and tell our viewers some of the interaction that our patients or a patient should have with their medical doctor regarding some of these risk factors.
Absolutely. Please. So it is, the first step, of course, is to get in the door. And i.e., all of us have a natural reluctance to go in to see healthcare providers. And, we hope to change that to make things much easier in our clinic and in every clinic in Volusia County and every doctor's office in Volusia County. The first thing I want to say, it is challenging for patients a lot of times to get into the doctor's office. It's challenging to schedule. Sometimes there's waiting. It may not be the most comfortable thing. And so I'm here to tell everyone here that we're trying our hardest to make this as pleasurable and as easy as possible for people. So please get in the door, number one. Number two, when you get in the door, make sure that you come away from that interaction at least one time out of the year understanding what you need to do to prevent heart attack and stroke and what your personal risk is. Now, if the doctor hasn't made that clear to you, because sometimes we get tied up with other problems and other issues, please bring it up yourself. And what is my risk, doctor, of heart attack or stroke? And how can I reduce that risk? And again, the doctor may or may not have an exact answer for you, but they will have exact answers on how to reduce your risk. Now, very specifically, you want to make sure that you know your blood pressure, you know your cholesterol, you know how your sugar is doing, and you want to have a goal for exercise, how much you're doing, and you want to have a basic understanding of the principles of a good diet. And your doctor may provide that directly, may have their nursing provided, may refer you to a dietitian. may refer you to other experts who may help it. So again, there may be multiple people in the healthcare continuum that help us help the patients and that you may go to. And again, informational material is out there, such as programs like this, kindly hosted by the city of Deltona and by Halifax. So all these things are important. So I hope that you go into the doctor's visit with some ideas and some questions. Never be shy. Always ask and always get the information you need.
We all have faced the moment of whether we tell the doctor everything or whether we're sensitive or embarrassed. So I think we and all our listeners can relate to that. Well, let's go to today. What can our listeners, can our audience do today to start reducing the risk of cardiovascular disease?
Absolutely. Very specifically, some of those, there are really 7 things that if good, solid research has shown that if someone does all 7 of these things, they will reduce their risk of heart attack and stroke by between 80 and 90%. Number 1, do not smoke or get help to stop smoking. That is perhaps one of the biggest things. Now, everybody in the country, everybody in the world knows that cigarette smoking is bad for you. It is a very big risk factor for heart attack and stroke. Now, it's easy for me as a doctor to say, don't smoke. But as I said, it's sometimes the question is getting help to stop smoking, because now we have the tools to help many, if not all, patients stop smoking. And the facts are simple. More people in the United States have stopped smoking than are currently smoking. So more people have been successful, in quitting smoking than are currently still smoking. And so our smoking rates in the United States have dropped from over 40% to in the low 20% range. And so, very interesting. And we've got the tools. Please, talk to your healthcare professional and other people who are knowledgeable about stopping smoking. And that can help. So number 1. Number 2, exercise. Another bane of everyone's existence. It is, of course, very important. Everyone knows this now. And so we, of course, want a goal. And our goal is to start slowly and consistently, but no excuses. If there's one thing I've learned from the exercise masters, from the people that help everyone from wheelchair-bound patients to stroke patients to heart attack patients to someone who's trying to prevent these things, is, don't say, I can't do it today. You can do it. And so all it takes is 10 minutes a day, and every one of us has 10 minutes. Now, we start at 10 minutes, and we try to work our way up. And all we need, by the way, in the end, our final goal is 75 minutes a week. That's an hour and 15 minutes a week of vigorous exercise, or 150 minutes, which is 2.5 hours a week of modern exercise. So, starting out at 10 minutes a day, you're already halfway to the goal. And how much exercise do we have to do? We don't have to join a gym, although if you like the gym, join it if it works for you. Another interesting idea I'd like to put forward is that people think you have to kill yourself. It's not true. People think you have to do one thing or another, that you have to do treadmill, you have to walk, you have to swim. No, you have to do what works for you. All that we need you to do is to be doing something where you're exercising continuously for at least 10 minutes, and you're doing something that's more than a light walk. And so you don't have to walk, you can do anything. We tell people, be creative. People in wheelchairs can do it. And they're pushing out against the wheelchairs, a whole series of exercises. These are real and they work, and good science has shown that they work. So, we try to cut through naturally. Everybody has resistance to it. But
yes, we do.
Yes, me too. Every one of us has a busy lifestyle and lots of stresses. But it is true, I'll tell you from personal experience and thousands of patients and scientific research, that exercise decreases stress, makes you feel better. Now at first, you do it and but actually often within a few days you already start to feel better. One reason why sometimes people don't have that happen is they're trying to do too much at once. So okay, let's start slowly, let's be consistent, let's make no excuses, and but let's do it. Okay, so that's exercise, number 2. Number 3, we started with some hard ones here. Weight. Now, again, a big problem in the United States, the number 1 or number 2 public health problem, depending on how it's looked at. And And it is a complex problem of lack of exercise we just talked about, and the poor diets that we eat and the stresses we're under. And we don't want everybody to go out and get down to some ideal body weight. We want people to lose 5 pounds. That's all. 5 pounds, yes. And if we lose 5 pounds, we get so much value. It's incredible. And again, that dovetails into 0.4, so 0.3 weight loss. Perhaps the hardest of all the points, honestly. But we don't need much. And we need, and then when you lose, you keep it down. That is, the key. Lots of people have lost millions of pounds and then gained them back. So if you can lose 5 pounds and keep it off, that's where the money is, as we like to say. Number 4 is diet. Now, this is perhaps, in some ways, is the easiest modifiable factor and perhaps the most important. Honestly, it is. Okay. Because, and now again, I alluded to the fact that everyone is completely confused by the, changing, guru advice of the best diet. I love Dr. Oz. He's a great doctor, actually, but and full of many good pieces of information. But that kind of presentation has led to some confusion about diet. And I want to make it simple. Couple basic points. Fundamentally, more fruits and vegetables. 2 ways to look at it. 5 servings a day of fruits and vegetables, or if you like cups, 5 cups a day or more of fruits and vegetables. That alone, that one fact alone, is perhaps the most important. Because if you do that, and it is a challenge, very few people, we polled hundreds of patients in our specialty clinic when I ran a specialty clinic and we did this work, and very few patients met it, and we were in had a health conscious patient population. It is challenging, no question. But so let's go to the market, let's get the fruits and vegetables, let's start incorporating. And again, nobody's going to eat anything they hate. So if you hate it, don't eat it. Find stuff that you like. There's many fruits and vegetables. Okay. So we want people to have 2 servings of fish a day. This is Florida. We're lucky. And
we are.
Yes, we are. And there are a few people that don't like fish. Okay, don't get too bent out of shape about it. Again, you probably can find something that you like, and but if you don't, that's we only need 4 of the 5 dietary points, as it were. So number 3, have 3 or more servings every day of fiber-rich whole grains. So really try to avoid the pasta, the white bread, many of these things. And we want small servings because it turns out that high carbohydrate, high rice, pasta, and unfortunately this is Deltona. Rice is king.
Yes.
And I mean, that's the reality of it. But we know that white rice is actually a pretty bad food. And Dr. Grundy, who I mentioned already, Dr. Grundy, who I love, has a saying, says, if it's white, flight, i.e. avoid it, avoid white. And white is flight. So, and brown is good. White is flight, brown is good. So brown rice, whole grains, but fundamentally a lot less carbohydrate and grain.
So whole grain is good.
Whole grain is good.
Excellent.
Yes. Excellent.
I asked you the question a while back about whole grain bread, and you
Yes.
clarified that, in fact, it is a good and better choice.
Of course, and in moderation. That's not going to be our top tier.
Right.
And now let's get down on the sodium. That's another goal, is to get the sodium down. So essentially no added salt, staying away from salty foods, and your doctor can tailor an exact sodium or salt content.
Intake, yeah.
Yes, and then last is much less sugar consumption. That is a big problem. And so high sugar foods. And again, people understand that concept, but it's even more important than we thought. The first place to start is in sugar drinks. If, we should limit, the official goal is to limit to less than 3 per week, but the real goal is 0.
Okay.
Yeah, and so less sugar drinks. So those are our, 5 dietary, guidelines. And they are perhaps the linchpin of the whole thing. So fruits and vegetables, more fish, whole grains, much less of other grains, lower sodium, lower sugar. Notice I didn't mention much about meat. There's no discussion here about that. You know, not that you need real low, not that we want real high. When you do these other things, meat takes care of itself. Okay. And so that's the first 4 of our 7. We've worked with our smoking, exercise, very moderate weight loss, but sustained weight loss. Most important thing, diet. Okay. 4 of 5 things. And then we want to keep the cholesterol down. Now this is something you won't know yourself, so you have to go to the doctor. And so when you're at the doctor, again, the doctor may have a more specialized goal for each of us, but generally speaking, we want the bad cholesterol, the LDL, below 100. Now again, so I know cholesterol engenders a lot of confusion and a lot of numbers are bandied about, but just remember 100. That's an easy number. It's a nice round number, and that's the bad cholesterol. Again, your doctor understands this well. All you have to remember is my bad has to be under 100. Yeah. Good. So that's easy. Now we also, number 6, keep our blood pressure down. Another very important one. Now again, that's one that you won't know, but you have to go into the doctor. And we'd like it under 120/80, much lower than what we used to tell people. And we don't want to do that as much. We don't have to do that with a million drugs. Some people need a number of drugs, absolutely. But by doing the first 4 things that we mentioned, you're going to affect blood pressure quite a bit. But we do need a target under 120/80. And then I saved number 7 of our 7 points. So, again, I apologize to you and the viewers that, a little bit complicated to talk about 7 things, but fortunately they all mesh with each other. Yes. And so the 7th of the 7th thing, the one that's the most under the radar for patients and doctors is the blood sugar. And again, we talked about a lower sugar diet. We talked about a lower simple carbohydrate diet. We talked about some whole grains. We talked about 5 servings of fruit and vegetables. We talked about exercise. We talked about weight loss. And making sure that blood sugar is down. So get your doctor to check your blood sugar. So these 7 things can reduce risk.
Excellent. One last question before we finish. You and I have talked about heredity and how family factors or family history affects. Give us a short take on
very
that
important.
factor.
Very important. And so the family history is extremely important. Every doctor wants to know it. And this is an exciting area of future research. We actually have it in the clinic now to a certain extent. That's a little more in the specialized realm of doctors such as myself that are subspecialty trained in this area. But this is an exciting area that in the future, and this isn't going to be distant future, we'll be able to test every person and know their genetic risk in detail for heart attack and stroke, probably even cancer as well. And this is not pie in the sky. This is probably the next 3 to 5 years, and it will be affordable and a tremendous boon. At the moment, so it's exciting research, and in the specialty clinic that we ran, we did some of that work and found it even now to be helpful. And so it will be coming. Stay tuned. There'll be a future program in the next few years.
That's right.
We'll be back and discuss the advances in genomic medicine.
Well, on behalf of our viewers, thank you very much. Your insight and information are incredibly important and to the point of long-term wellness. For our viewers, I want to remind that Dr. Blume can be reached at 386-425-3300. His clinic is at 2090 Saxon Boulevard, right off exit 111 by the interstate. Or you can reach to us through our website at halifaxhealth.org. Again, halifaxhealth.org. Thank you, Dr. Blume.
Thank you, Raphael. My pleasure.
Yes, sir.
Thank you.